So with that, why don't we just kick off? So as I said, this is our overview of the workforce stabilization and supplemental payments. Wanted to make sure again that we try to walk you through the attestation that was distributed last week, and begin to talk about the survey result, the survey document, the survey instruments that we'll also be relying on to help support some of the other payments we'll be talking about. But wanted to give you this verbal walkthrough, and we did receive some questions that we'll be trying to address, time permits, at the end of the session. If you do have questions, just please ask them through there's a chat option, right, that they can post questions through a Q&A period. Okay, so, and we'll be, logging those and trying to get information back out to you through a website or another FAQ type of instrument to help you all as you work your way into, through the process. So with that said, as you all know, OPWD is using a significant portion of the Enhanced Federal Medical Assistance Percentage, or eFMAP, funding that's made available through the American Rescue Plan Act, otherwise known as ARPA, to make Workforce Stabilization Initiative supplemental payments to OPWD providers. These will be used for one-time workforce enhancement bonuses for eligible direct support professionals and family care providers. Eligible providers include those providers who are licensed or certified by OPWDD under the 1915C Comprehensive Waiver as defined in the approved Appendix K revision and in the Disaster SPA revision. The SPA itself, or State Plan Amendment, is anticipated to receive federal approval. However, as of today, we do not have federal approval to replicate these payments in state plan authorized services. I also want to make a critical definition point here, and I'm telling you as much as I know at this point, and that's that if you happen to be a contracted provider in with PHP, Partners Health Plan, in the FIDA, you will be, you should expect to see your payments divvied up between fee-for-service and payments from the plan. Based on federal guidance, we cannot make complete payments through fee-for-service for those agencies that also are delivering supports and services through managed care products. So more to come on that. I just wanted you all to be aware of it, that for those that have that kind of crossover or interrelationship, you will, in essence, get the same payment level we're calculating, just will come in through two separate mechanisms. I also want to clearly indicate that, the funding associated with these workforce stabilization initiatives is intended to address the critical direct support professional, employee, and family care provider shortages stemming from the COVID-19 public health emergency. We have received, some feedback about people who are not defined as Title Code 200 series in the cost report, such as the 100s and the 300s, clinical and support. Those staff and expenses in those categories are not the subject of these enhanced payments. This is for the direct support professional, employees that all of us rely on a day-to-day basis. Next slide. So I just want to give a quick overview here about the types of payments that you can expect to see and that we'll be talking about today, and that the attestation covers, again, regardless of funding authorization, whether it be the waiver via the Appendix K, disaster state plan amendment, or even offline contract payments. These payments are applicable to all of those sources, and the attestation governs each one of those payments that you may receive. So first and foremost is what we're referring to as the COVID-19 service payment. This is targeted to direct support professionals and family care providers who worked during the pandemic period, which has been defined as March 17th, 2020 through September 1st, 2021, for at least a 90-day period. And I just want to classify or put a little asterisk next to that 9/1/21 period. It's payroll that ends on or immediately after September 1st, 2021. The vaccination payment is a payment that's targeted to direct support professionals, DSPs, and family care providers that have completed the COVID-19 vaccination regimen. At this point in time, we're defining the regimen to be you've had one shot of J&J or your second shot of Pfizer or Moderna at the time the payroll data needs to be submitted to OPWD via survey. Now we have two other, I kind of call these like 3A and 3B payments. So we have what are known as a longevity and retention payments. The longevity is targeted to direct support professionals and family care providers who worked during the April 1, 2020 through 3/31/2021 period. And the retention payment is more of a prospective look. Think of the longevity as a retrospective, snapshot, and the retention payment is a prospective snapshot targeted to DSPs and family care providers who will work during the period of April 1st, 2021 through the payroll period that ends on or prior to 3/31/2022. Next slide, please. There are two real mechanisms I think we want to discuss with you today that draw your attention to how we're, implementing these payments. They're not automatic. Providers are expected and required to complete an attestation that you received last Tuesday, signed by both the president of the board and the CEO, and returned to OPWDD by no later than January 9th, 2022. That really, in essence, indicates your agreement to the terms and conditions related to these, the payment of these Workforce Stabilization Initiative funding. So think of the attestation as the application process, okay? That's how I'm trying to simplify this. In order to be eligible to receive any money, we have to have that attestation appropriately completed with the, 7 or so data elements, including signatures, returned to OPWD by no later than January 9th, 2022. To assist with the effectuation of other payments, really some of these payments, the service payment and the vaccination payment, we've developed a survey to determine the number of DSPs and family care providers who worked during the identified and aforementioned periods. The survey is only applicable to the COVID service and vaccination incentive payments, meaning the longevity and retention payments are being calculated centrally by OPWDD, DOH, and Deloitte, and we will be using CFR data from the 2018-19 and 2019 periods to determine what a 20% adjustment would look like, based on your reported direct care Title Code 200 series spend in that CFR period. Why was that CFR period, used? One, it was pre-pandemic, and two, it also was kind of re-verified, I think, by many of the providers. I think, Joanne, we had at least 50 that were resubmitted as we were going through the new rate, the new rate methodology. We were looking to use the 18, 19, and 19 periods to support that and ask that you all review and update that for accuracy. So we had a pretty, significant number of provider agencies that corrected the CFR data for the 2018, 19, and 19 periods on file. So we have the most confidence in that data. So we'll talk a little bit more in the coming several slides. And once you get too tired of my voice, Joanne will take over to really give you a brief overview of the attestation details, and then Joanne will wrap it up with the overview of the survey and the questions that we're looking to have addressed from each of those instruments. So the Workforce Stabilization Initiative's overview and provider attestation form sets forth detailed guidance for the distribution of Workforce Stability Initiative payments to employees. However, the guidance cannot address every unique situation that will be faced by a provider related to the distribution of funds. Therefore, what we're trying to make sure you understand and are comfortable with is that we're trying to outline a series of principles that each of your, how you would each use these funds are intended to address when you develop your distribution plans for these resources. So the purpose of the funding is to reward direct support professionals and family care providers for past work performance, especially during the COVID pandemic, and to incentivize such staff and provider retention going forward. Again, focus is on DSPs and family care providers. The goal is to increase base salaries for DSPs and family care providers through the distribution of a salary bonus to eligible employees. A detailed distribution plan is to be developed that at its core recognizes the best interests of DSPs and family care providers. The distribution plan is and must be clearly communicated to all staff prior to the provider's distribution of the Workforce Stabilization Initiative funds to its employees. What we're trying to get ahead of here is in prior targeted compensation increase enacted under state statute, my own personal experience was, there were in Joanne's as well, was that we had many questions about staff asking where their money was, when am I going to get my 2%, when am I getting my 3.25%. And what we're trying to, we're trying to short circuit that here by making sure that each agency clearly communicates its intent to use, how it will use these funds to its employees to ensure that there's constant communication, one, but also to avoid, this need for us to kind of keep following up with each of you to make sure that attestations were received, et cetera. So we want to make sure that there's a clear, communication with DSPs, again, with the focus being trying to do the right thing, financially for direct support professionals and family care providers by recognizing, their past and current work to support people with developmental disabilities. Next slide, please. So attestation requirements. Again, we just talked about kind of guiding principles, right? The kind of underlying notions that we want as you all begin to prepare these plans and think about how you're using the monies. Now we'll talk a little more specifically about the attestation itself. And as I said earlier, each agency wishing to participate in one or more of the OPWDD workforce stabilization initiatives must acknowledge and attest that it will adhere to all of the following requirements prior to receiving any supplemental payments. Again, return of the attestation is considered to be an application. So let's talk about some administrative housekeeping, record keeping. The provider must retain all records necessary to document the distribution of these payments, including but not limited to employee payroll records and proof of vaccination, consistent with the New York False Claims Act and all other applicable state and federal laws and regulations. Such information shall be available in a form and format that will facilitate it being furnished upon request to OPWDD and or other regulatory authorities. The point here is these are, at the end of the day, these are large sums of money. We will definitely be audited by the federal government, and we want to make sure that each downstream recipient has appropriate documentation to support how they use the money, consistent with everything we're going to talk about here and any subsequent guidance and direction given on our website as we roll this out. Payment expenditure. The provider must expend all Workforce Stabilization Initiative supplemental payments exclusively for the purpose specified, for the purpose specifically identified by OPWDD. Payments cannot be commingled and or utilized by provider agencies across initiatives, meaning we're looking at them kind of siloed here. For example, COVID service payment resources cannot be used to supplement or supplant vaccination incentive payments, longevity payments, or retention payments. Similarly, HCBS waiver payments cannot be used to supplement or supplant payments made under state plan authorities. The supplemental payments made to provider agencies will be inclusive of the funds that are expected to be distributed to qualifying staff and any related mandatory fringe benefit costs. Now, what that means is, we really did rely on the cost report for 2018, 19, and 19 to identify provider-specific amounts. From those cost reports, we were able to identify your mandated fringe benefit percentage. That mandated fringe benefit percentage is applied to all applicable payments to ensure that, any related mandated costs can be funded appropriately that are associated with these supplemental payments. Again, provider-specific mandated fringe benefit percentages have been used based on that cost report. Next slide, please. So, employee eligibility. Kind of alluded to this a little bit before, but we'll go into it on this slide. The provider must only distribute Workforce Stabilization Initiative supplemental payments to those direct support professionals, DSPs, including contracted staff serving as DSPs, and/or family care providers that are appropriately reported as direct care staff, meaning those that are identified as Job Position Title Code 200 series in the agency's consolidated fiscal report, supporting OPWD licensed programs and services. So, a DSP's effort on Access VR does not, was not factored into our payment calculation here. If an employee's position is jointly allocated between a 200 to 299 job position title code and another non-qualifying job position title code, disbursements to that employee shall be based on a proportional allocation of time between the time spent in the direct care position versus another non-qualifying position. So there's a lot of words here, but what that really means is we're looking to only pay the percentage of effort that employee, put forth while fulfilling a direct care, direct support function within your agency. It's not that, Kevin was doing some work and 20% of his time is DSP. I don't take 100% of Kevin's effort here. It's that 20% of Kevin's, salary that would go into this calculation. Next slide, please. Timing. So this one I'm going to spend a few minutes on just to make sure it's clear. The provider must expend all Workforce Stabilization Initiative supplemental payments, except for retention payments, through distributions to eligible DSPs and/or family care providers no later than 90 days, 90 days, after receipt of the funds. With respect to retention payments, so before I go on, let me just be clear what that means. So within 90 days of receipt, the vaccine payment, the COVID service payment, and the longevity payment, all those dollars should be made available to direct care staff, must be made available to all direct care staff, again, within 90 days of receipt. With respect to the retention payments, we're asking and directing that an initial expenditure of funds be made to eligible DSPs and family care providers within 90 days of receiving the funds. However, the balance of the retention payments must be fully expended through distributions to eligible direct care staff and family care providers no later than 180 days, 180, after receipt of the funds. And so what we try to recognize here is that, these are by definition retention payments that are geared at helping to reduce attrition rates and keep qualified staff in your employ. So we are giving a greater time period to allow you to do what you need to do to ensure, staff retention and minimize attrition on a prospective looking basis. Okay, next slide, please. So claims history. I'm going to read this, but what in a nutshell it's saying is that you can't just have claimed a retainer claim during the period to be eligible. You also had to have actually delivered non-retainer day services to eligible individuals. And this applies both to the 1915C waiver and state plan authorities. So again, I'll just read through this for the record. The provider must have made at least one eMedNI claim related to the billing of an HCBS waiver service during the period between March 17, 2020, the onset of the pandemic, and September 1, 2021, to receive HCBS waiver-funded supplemental payments. Provider claiming of retainer payments, including but not limited to the COVID-19 Day Service Retainer Program, do not qualify as an eligible service billing. Similarly, now for state plan services, and again, just for the record, the provider must have made at least one eMedNI claim related to the billing of a state plan service during the period between March 17, 2020 and September 1, 2021 to receive state plan funded supplemental payments, again, pending federal approval. Provider claiming of retainer payments, including but not limited to the COVID-19 Day Service Retainer Program, do not qualify as an eligible service billing for this purpose. Next slide, please. Reporting requirements. Now, this is pretty open-ended because I think we're still trying to determine, the best elements of data that we can collect to help ensure the effectiveness of these payments. But through the attestation, the provider is agreeing to submit all reports required by OPWDD in conjunction with these workforce stabilization initiatives to enable an evaluation of the effect of the supplemental payments on workforce stabilization in the form, format, and within the timeframes delineated by OPWDD. I think you all get a sense of what kind of reporting we've been looking to receive over the last several years and even more recently. So things that come to mind for me are participation in the NCI Staff Stability Survey. I think the last go-round we had about 70% of the providers responding to that. We'd expect that to be 100% of this pool of agencies that receive these funds. We'd also, like to see 100% compliance in reporting through the weekly REDCap reporting metrics and systems that are designed to, among other data elements, indicate, staff vaccination rates, right, at least an initial one shot, within the time period of time we're looking at. So again, as we see that data coming in, we're looking to make sure that we're able to understand that these payments have had, the intended impacts or not, and then, what that could mean for future policies. Now, this one is kind of a thing, basically the disqualification or recoupment, if there's an inability to comply with any or all of these requirements, we reserve the right to take the money back. But for the record, I will go through and read this as well. If the provider fails to expend all of the supplemental payments it receives to all of its eligible employees within 90 days of receipt or within 180 days of receipt for retention payments, or it is determined that the provider was ineligible to receive the supplemental payments, or the provider does not participate in the required survey or reporting processes, or in any other manner violates the terms and conditions of these workforce stabilization initiatives, OPWDD and or the New York State Department of Health will conduct an immediate recoupment or take other action necessary to retrieve up to 100% of the workforce stabilization supplemental payments the agency received. At the end of the public health emergency or at the conclusion of participation in the workforce stabilization initiatives, all supplemental payments to an agency will be subject to a final reconciliation. So again, just make sure that, as we talked about before, the documentation, the records are all kept in accordance with, all applicable New York State and federal laws, rules, and regulations, because there will be, an audit, a final reconciliation associated with these payments. Again, these are pretty significant in their aggregate dollar amount, and, should have a pretty good impact on reducing, attrition amongst the workforce. Next slide, please. So we also have a couple additional, so what we just talked about were broad strokes, right, in terms of what the attestation was covering for all of the, supplemental payments. Again, just to recap, COVID-19 service payment, vaccination incentive payment, longevity and retention bonuses, okay? So those areas that we just talked about apply to all. Now we have some initiative-specific requirements that we want to delineate. And I know, there may be this belief that we're being pretty prescriptive here. From our perspective, unlike previous targeted compensation increases that were enacted under state law, these are being authorized through an administrative process, with the federal government. So we want to make sure that we have clear guidelines and policies defined with the use of these monies to make sure that we have the intended impacts of reducing retention and recognizing the work that DSPs have performed throughout this public health emergency. So for the COVID service payments, that's what we're going to be talking about now. Survey completion. Providers must complete and return a survey in the form, format, and time frames specified by OPWDD to determine the amounts each provider may be eligible to receive. What that means is because of the level of information we're looking for, the type of data we're looking for, it cannot be gleaned from the cost report. We're going to require your assistance in completing surveys within the time periods that we've identified to help ensure as prompt and timely payments as possible. I've heard many requests about, the timelines and the need to immediately release these funds. So compliance with the timelines that we're providing herein is absolutely critical to ensure that payments are released within a reasonable and an appropriate time frame. Again, with respect to the COVID service payments, payment distribution. Providers must distribute payments of a minimum of $1,000. The word play here is critical. Minimum of $1,000 consistently and equally to each DSP and family care provider that was employed full-time in such capacity for at least a 90-day period. Sorry, I'm messing up. I can't even read right. For at least 90 days during the period of the first agency payroll that occurred on or after March 17th, 2020, through the first agency pay period that occurred on or after September 1, 2021. So again, back to that high-level timeline. And is employed by the provider agency on the date the provider agency distributes the COVID service payment. Okay, so I highlighted the use of the term minimum. We know that these are kind of older, time periods, and we know that by the time we get the survey back and, we calculate your payments, additional time have elapsed. In that intervening time period, you may have had more attrition. So the use of the term minimum is intended to say that for a full-time equivalent employee, if you had 3 people and you were getting $3,000, 3 full-time equivalent employees and you were getting $3,000 and one of them left, we don't want to be in a position of taking that money back, right? What we'd like you to do then is for the 2 remaining eligible full-time equivalents, you would pay them each $1,500, right? That's why the language of minimum, as we talk about not only the service payment and go through the different levels of effort of staff, but also applicable to the vaccination incentive payment as well. Next slide, please. Again, payment distribution. So we're talking about less than full-time here. Providers must distribute payments of a minimum of $500 consistently and equally to each DSP and family care provider that was employed at least, but not fewer than 20 hours per week. So I've seen questions how we're defining full-time. I think it's implicit in these words here, which is why we're going off on the record about what they mean. Of at least, but not fewer than 20 hours per week for at least 90 days during the period of the first agency payroll that occurred on or after March 17th, 2020, through the first agency payroll that occurred on or after September 1, 2021, and is employed by the provider agency on the date the provider agency distributes the COVID service payments. again, I kind of interestingly stressed is there, but what that means, right, is that if you lost Kevin, who is a valued DSP, and he came and you were able to entice Kevin to come back to work and was employed, and you were able to employ Kevin, by the time you receive payment, Kevin would be eligible to receive a payment. So again, we're trying to give as much flexibility here, recognizing the dynamic nature of the workforce and the critical skills that DSPs and family care providers have to allow the flow of as much money as possible to help bolster, you know, this area. Next slide, please. Payment distribution, again, on the COVID service payments, continuing the conversation here, and I think we jump into the vaccine payment. Providers must distribute payments of a minimum of $250 consistently and equally to each DSP and family care provider that was employed fewer than 20 hours per week for at least 90 days during the period of the first agency payroll that occurred on or after March 17, 2020, through the first agency payroll that occurred on or after September 1, 2021, and is employed by the provider agency on the date the provider agency distributes the COVID service payment. Okay, so again, quick recap, $1,000 minimum for full-time, for, you know, less than full-time, but no more, but equal to and greater than half-time, $500, for less than half-time, $250, okay? Now, I know there's going to be, we'll go in there in a second. Employee use of sick leave and other paid time off during the period shall count toward the 90-day employment requirement. Now, I know I've got some questions offline and through the mailbox. Well, what if I was, you know, eligible for at least 90 days of full-time and 90 days of part-time? Do I get two payments? This bullet addresses that point. Each eligible DSP and family care provider cannot receive COVID service payments that in total exceed the amount distributed to a full-time employee. So if I was full-time for 90 days, part-time for 90 days, I can only get no more than whatever the agency is distributing for people in the full-time position. Next slide, please. So now we're changing gears. We're talking about the COVID service payment. Now we're going to talk about the initiative-specific requirements related to the vaccine incentive payments. Again, survey completion. Providers must complete and return a survey in the form, format, and time frame specified by OPWDD to determine the amounts each provider may be eligible to receive. Payment distribution. Again, following the same logic of, you know, full-time and less. We'll go through that. Providers must distribute payments of a minimum, again, same flexibility here, of $500 consistently and equally to each DSP and family care provider that was employed full-time and has completed the COVID-19 vaccination regimen as of the first complete agency payroll that ends on or after January 14th, 2022, and is employed by the provider agency on the date the provider agency distributes the vaccine incentive payments. Now, you'll notice, for those of you that have been reading the ARPA plans since their release on July 8th of 2021 on the DOH website, we originally had an early December date for those vaccine incentive payments. We pushed it out, recognizing the delay in approval of the Appendix K to allow for enough time for people to get their two-shot regimens as well, right? And by regimen, what I'm meaning here is if you're a J&J recipient, which there may be less and less of us out there now, you know, the J&J recipient has to have their first and only shot by January 14th, 2022, just using that as my pay period end date, for example. If I elected to get Moderna or Pfizer, I need to have my second shot in the arm by that date. You don't have to wait 3 weeks to be determined to be, quote, fully vaccinated. It's just, you know, getting that second shot in the arm by that reporting date. Okay? Next slide, please. Again, continuing with the vaccine incentive payments, providers must distribute payments of a minimum of $250 consistently and equally to each DSP and family care provider that was employed at least, but not fewer than 20 hours per week and has completed the COVID-19 vaccination regimen, as we just previously discussed, as of the first complete agency payroll that ends on or after January 14th, 2022, and is employed by the provider agency on the date the provider agency distributes the vaccine incentive payments. Next slide, please. Again, following the logic, half of a half of a half, providers must distribute payments of a minimum of $125 consistently and equally each DSP and family care provider that was employed fewer than 20 hours per week and has completed the COVID-19 vaccination regimen as of the first complete agency pay period that ends on or after January 14th, 2022, and is employed by the provider agency on the date the provider agency distributes the vaccination incentive payments. Again, similar issue, right? Maybe I've, worked in multiple, capacities here. Each eligible DSP and family care provider cannot receive vaccination incentive payments that in total exceed the amount distributed to a full-time employee. And again, we're not being prescriptive here about the $500, right? Because based on each of your own unique positions, you may be able to give out more than $500. You can't give out less because the eligible pool is always a defined class of staff, right? You're never going to gain more and more eligibles, but you can lose eligibles to attrition. And so we wanted to make sure that that minimum language has been, is understood and is, been called out as part of this conversation. Okay, next slide. You want me to finish this up?
No.
Okay.
We are going to identify further that the vaccination documentation is as follows. Providers must retain employee vaccination documentation and furnish it upon request to OPWDD or other regulatory agencies. Complete documentation must be legible and must include the manufacturer, the lot numbers, the dates of vaccination, and vaccinator or vaccination clinic site. The following are acceptable forms of documentation of vaccination. The first is the Centers for Disease Control, or CDC, vaccine card. The second, the World Health Organization, or WHO, yellow card. The third, documentation of COVID-19 vaccination from a licensed healthcare provider. Or, number 4, a digital record, such as the New York State Excelsior Pass, that includes a quick response code, which, when scanned by a smart healthcare reader, displays to the reader the vaccine recipient's name, date of birth, vaccine date, and vaccine type. Okay, we're going to move on now to discuss longevity payments. First of all, the providers must distribute payments to each direct support professional and family care provider that was employed at some point during the period of April 1st, 2020 through March 31st, 21, and continued to be employed by the provider agency through the first complete payroll that ended on or after September 1st, 2021, and is employed by the provider agency on the date the provider agency distributes the longevity payment. The payments must be in the form of a one-time salary increase, enhancements to or payments for fringe benefits are not an acceptable use of supplemental payments made to providers, unless related to mandatory fringe benefit costs associated with the one-time salary increase. And I'm going to emphasize that because even after sending the attestation information out to providers, we have gotten more than one question asking whether an appropriate use of the initiative payments would be for fringe benefits. They are not. You cannot use this money unless it's to offset mandatory fringe benefit costs. And as Kevin identified, we have, for each agency that reports on a consolidated fiscal report, we have identified what that mandatory fringe benefit percentage is. And this, what I'm going to be going over is a little complicated, but we think it will be quite useful as you're determining how to pay out the longevity payments that are given to you. Now, the goal is a 20% increase in salary in the form of a bonus for each direct support professional who is directly employed by an OPWDD provider. But we know, because these calculations will be based on a historical consolidated fiscal report, as Kevin had previously identified, 2018, 2019, or 2019, is that the amount that we give you in the form of a supplemental payment will not exactly mirror 20%, unless you're extremely lucky. But it may be less, it may be more. So you really have to calculate through, and we've given you the formula, what money, what percentage has to be utilized as a calculation percentage for disbursement of these longevity payments to your staff. So let's go through that calculation. For direct support professionals employed directly by an OPWDD provider, providers must distribute payments to eligible DSPs such that each DSP receives a payment which represents an identical percentage increase. Everyone gets an identical percentage increase calculated relative to their annual base salary. Now, we've gotten some questions about base salary. Base is their negotiated salary. It is prior to any overtime. It's their annual, that employee's annual negotiated or identified annual salary. Okay, so the formula is the total amount of the longevity payment received. What is the longevity payment amount that you received from OPWDD divided by 1 plus the agency mandated fringe benefit percentage. Now, why do you make that division? Because you must take into account agency mandated fringe benefits. So dividing by that amount gives you the net, which is the net to be distributed net of mandated fringe benefits. You divide that by the aggregate base annual salaries for all DSPs eligible for the longevity payment, and that equals your payment distribution percentage. That's the percentage that has to be distributed to all employees. For allocated employees, only that portion of the base salary allocated to the CFR Job Position Code 200 series is to be utilized. Each DSP's longevity payment is their base annual salary or allocated base salary multiplied by the payment distribution percentage. Now, I'm going to be a little more clear about this 200. If you are allocating in this calculation a person's position to the 200 series, that is the way it must be reported on your consolidated fiscal report. So you can't make that allocation just for the purpose of this initiative. We should be able to tie, if we were to do an audit, we should be able to directly tie the individuals, even if it's an allocation, the individuals that were given this longevity payment to the reporting of work effort on the consolidated fiscal report for the period. Then we will be more specific about family care and fiscal intermediary payments. But before we do that, let's be very clear that we have the overall guidance that these are for the periods of 4/1/20 through 3/31/21, But when we calculated family care and fiscal intermediary, we could have more clearly indicated the link between the dates we used for calculating those payments and the payment dates, the dates the individuals were actually working for the agency. So please keep that in mind. We will probably put a clarification to that effect in with questions and answers. But under family care and fiscal intermediary versus what we had discussed with reference to direct employees of the agency, the calculation period is September 1st, 2020 through August 31st, 2021. And let's go over that. For family care, providers must distribute payments to family care providers based on the difficulty of care payment level. The sponsoring agencies cannot retain any portion of the payments to family care providers. Each family care provider shall receive the equivalent of a one-time 20% increase to the difficulty of care payments based on paid claims activity for the period of September 1st, 2020 through August 1st, 2021. Again, I'm emphasizing that date, September 1st, 20 through August 31st, 2021, is how we will calculate the reimbursement to the provider for the supplemental payment. Then under fiscal intermediary, for direct support professionals for whom the fiscal intermediary is the employer of record, each such DSP shall receive an identical percentage increase calculated relative to the salary they receive for the hours worked during the period of September 1st, 2020 through August 31st, 2021. Again, that is our calculation period. The formula is total amount of longevity payment received divided by 1 plus the agency mandated fringe benefit percentage divided by the aggregate annual salaries paid for hours worked for all DSPs eligible for the longevity payment equals the payment distribution percentage. Each DSP's longevity payment is the compensation they received for the hours worked during the period of September 1st, 20 through August 31st, 21, multiplied by the payment fringe benefit or payment distribution percentage. Again, our calculation. And then we are identifying some more initiative-specific requirements. Providers must distribute payments to, we're moving on to the retention payments. The providers must distribute payments, the retention payments now, to each direct support professional and family care provider that is employed at some point during the period of April 1st, 2021 through March 31st, 22, and continued to be employed by the provider agency through the first complete payroll that ended on or prior to March 31st, 22, and is employed by the provider agency on the date the provider agency distributes the retention payments. Now, as Kevin had described, the language that we're giving you here does give you a little bit of flexibility if an employee was on payroll, left payroll, came back to work for your agency, and that was done purposely. The payments must be in the form of a one-time salary increase, enhancements to or payments for fringe benefits or not an acceptable use of supplemental payments made to providers. Once again, we're stressing that, unless related to mandatory fringe benefit costs associated with the one-time salary increase. The formula, which is very similar to that of longevity, is for direct support professionals employed directly by an OPWDD provider, providers must distribute payments to eligible staff in accordance with either the methodology described in paragraph A or paragraph B as follows. Now, you'll recognize paragraph A because it is actually word for word, except we're replacing retention with the word longevity with the formula that is utilized for longevity, but we'll go over it. Each direct support professional receives an identical percentage increase calculated relative to their annual base salary. The formula is total amount of retention payment received by the provider divided by 1 plus the agency mandated fringe benefit percentage, again, to recognize the net that must be distributed, divided by the aggregate base annual salaries for all DSPs eligible for the retention payment, and that formula equals the payment distribution percentage. For allocated employees, only the portion of the base salary allocated to the CFR job position title code, and I emphasize as is or will be reported on the CFR job position code 200 series is to be utilized. Each DSP's retention payment is their base annual salary or allocated base annual salary multiplied by the base payment distribution percentage. We have an alternative with retention for the distribution calculation, and that is as follows. For direct support professionals employed directly by an OPWDD provider, providers must distribute to eligible staff in accordance with either the methodology described in paragraph A or paragraph B as follows. So why did we give you A or B? It's either or. You either conform to A or you conform to B, and you conform to that which best meets the needs of your agency to retain staff. That's why we offered some flexibility in these requirements. But B states that each DSP receives a percentage increase in accordance with an agency-specific distribution plan to address its own unique recruitment and retention challenges. The distribution plan must specifically detail the methodology the provider will utilize to distribute retention payments to eligible DSPs. The distribution plan must stipulate a minimum level of retention payment for each eligible DSP that was employed at some point during the period of April 1st, 2021 through March 31st, 2022, and continued to be employed by the provider through the first complete payroll that ends on or prior to March 31st, 22, and is employed by the provider agency on the date the provider agency distributes retention payments. Now, some of this is, as Kevin said, we're emphasizing the fact here that you develop the distribution plan. That plan is clearly communicated to all your staff, and that every eligible DSP must receive something. With prior initiatives, we did hear from DSPs that received no compensation from the salary enhancement and had no idea why, or maybe missed out of the meeting, but they did not feel that their agencies clearly communicated why they did not receive a payment. Here everybody must, and the distribution plan must be known to every affected employee prior to distributing any of these retention funds. The distribution plan must be in the form of a document that is signed by the agency's chief executive officer or an officer of the agency's board of directors. Here, with the distribution plan, it can be any officer of the board of directors. As Kevin identified earlier, the attestation must be signed by the president of the board. The signed distribution plan must be made available and clearly communicated, as I said, to all employees prior to payment. The distribution plan, including all supporting payroll records, must be retained by the provider and furnished upon request to OPWDD or to any other regulatory agencies. And now we'll talk about specificity with reference to retention payments for family care or fiscal intermediary. And I make the same comment that I made here with reference to the longevity payments. There seems to be, a bit of a disconnect with the dates. Remember here, when I'm talking about dates of September 1st, 2020 through August 31st, 2021, this is how OPWDD calculated the payment. This is not the distribution period. This is how we calculated the payment. Again, we expect to give you a little more clarity in the questions and answers. But for family care, providers must distribute payments to family care providers based on the difficulty of care payment levels. Sponsoring agencies shall not retain any portion of the payments to family care providers. Each family care provider shall receive the equivalent of a one-time 20% increase to the difficulty of care payments based on the claiming activity for the period of September 1st through August 31st. This sounds just like the longevity because it is. Okay, and then under fiscal intermediary, for DSPs for whom the fiscal intermediary is the employer of record, each such DSP shall receive an identical percentage increase calculated relative to the salary they receive for the hours worked during the period of September 1st, 2020 through August 31st, 2021. The formula is total amount of retention payment received divided by 1 plus the agency mandated fringe benefit percentage divided by the aggregate annual hours paid for, salaries paid for hours worked for all DSPs eligible for the retention payment equals the payment distribution percentage. Each DSP's retention or payment is the compensation they receive for the hours worked during the period of September 1st, 2020 through August 31st, 2021, multiplied by the payment distribution percentage. Okay, so we are moving on now to a discussion of the COVID-19 service and preliminary vaccination incentive survey. As Kevin mentioned previously, the longevity and retention payments, and as we've described in the preceding slides, were based on information from a provider's consolidated fiscal report for the period of July 1st, 2018 through June 30th, 2019, or calendar year 2019. We don't have individuals worked for these time periods, so we don't have current information, so we have to survey providers in order to get the information that is necessary to compute the money that you need to pay out COVID-19 service and vaccination incentives. And that is the purpose for the survey. You'll receive a link to the survey after this webinar and after you have an accepted attestation submitted to OPWDD. Obviously, as Kevin says, the latest date is January 9th, 2022, but as soon as we get the signed attestation and we verify that it is signed appropriately, we will send you out a link to the survey because, as Kevin said, that is your application. The survey collection information that will be utilized by OPWDD to determine funding necessary to provide COVID-19 service and or vaccination incentive payments to direct support professional staff is what we are asking for in the survey. And every question that references information related to direct care staff is specific to staff that perform direct care functions for the time periods referenced that will be reportable within the job position title codes of 200 to 299 in the agency's consolidated fiscal report. And that does include contracted employees. It does include allocated staff, but again, I emphasize only if you are going to report the FTEs and costs for that allocated staff under the classification of 200 through 299 in the CFR. The provider may find it helpful to compile a spreadsheet of required survey data elements by OPWDD program prior to completing the survey. we're going to, at the end of the discussion of the survey, we're going to show you a sample spreadsheet document that you can utilize for this purpose, and we will give you a link to that document at a later time. If you operate more than 5 OPWDD programs, you'll have to complete the survey multiple times. It's an Alchemer survey, and the maximum number of programs that can be reported at any one time is 5. So, you know, you are going to have to give even the preliminary information again if you have more than 5 programs. Time intensive, we do know, but this was the best way that we could get this information from you. All right, let's get into the survey. And then I also want to be very clear here too. We are asking in this survey initially, we are asking for information as of September, the first payroll that ends on or after September 1st, 2021. And we're doing that because obviously we need that for COVID-19 service calculations. We're doing it for vaccinations so that we can get some preliminary data. As Kevin mentioned, and as I'm sure most of you are aware, we were going to collect a second survey as of December 2021. But then we changed the date to allow for more individuals to get vaccinated, to incentivize vaccination among, you know, the critical direct support professionals. So we changed the date to January 14th, 2022. So each agency is going to submit a survey for the payroll on or after September 1st, 2021, and again, additional information that will help us directly calculate the vaccination incentive period of payments, and that will be for the payroll period on or after January 14th, 2022. So I wanted to clear that up. All right, the first, when you go into the Alchemer survey, what you're going to see is a request for the agency name, agency administrative address, agency code, just some background information we need for record keeping. Then we need information on an individual to contact if we have any questions regarding the completion of the survey. So we're asking for the first and last name of the individual that completed it, their phone number, and that individual's email address. And then we're asking you to complete the following. That information reported must be compiled based on the agency payroll data for the first payroll period ending on or after September 1st, 2021. Then you select, you know, the OPWDD program that you're reporting on. We have a list of programs. It's pre-populated. You just identify, you know, which one you're reporting on. Again, this may be done multiple times. And then you identify the payroll ending date. And the reason we're asking for that payroll ending date is that we say the payroll period ending on or after September 1st, 2021. Most of you are not going to have a payroll period that ends September 1st, 2021. Why are we asking for it? Because at some time we may be coming in to audit your payroll. So we need to know what payroll you utilized. Okay. And then we'll start with the questions. Question A, the total number of discrete direct care employees. And we mean discrete direct care employees here. We don't mean FTEs. If you're used to filling out a consolidated fiscal report, you're reporting full-time equivalents, usually based on an agency standard work week. Could be 40 hours, 35 hours, 37 and a half, doesn't matter. That's not what we're asking for here. we're asking for discrete individuals. And individuals who were allocated or who are in the CFR job position code of 200 through 299. Why are we asking that? Obviously, it comports to the guidelines that we identified in the attestation. Who are currently employed as of the date of the completion of the survey by the agency and worked at least 90 days from the date of the first agency payroll period ending on or after March 17, 2020 to the payroll ending date identified above. So it'll tie into the requirements for the COVID service. Sick leave and other paid time off is counted toward the 90-day qualification. Then we ask how many are full-time employees, and then we ask you whether your standard work week is 40 hours or not. And then we ask how many are part-time employees who work 20 hours or more per week. Well, again, ties right into the attestation guidance. And then in D, we ask how many are part-time employees who work less than 20 hours per week. Again, ties right into the payments identified in the attestation guidance. But we also ask you to check here. I mean, if A is the total number, then obviously A must equal B plus C plus D. If it doesn't, you have a problem. You're going to have to go back and look at your numbers. Again, and we'll show you the Excel spreadsheet in a moment. It probably would be really helpful for you to fill out a spreadsheet, either the spreadsheet we give you, modified for your own needs, or anything else that you can create of a similar nature before you sit down and try to answer all these questions, especially if you have a multiple number of programs. You're going to want a spreadsheet in front of you so that you can refer to it as you're moving along. I think it would be very, difficult to perform this exercise without that type of document in front of you. Then E, we ask you for the total number of discrete direct care employees, again, CFR job position 200 through 200 only, who are currently employed as of the date of the completion of the survey by the agency and have completed the COVID-19 vaccination regimen as of the date of the first agency payroll period ending on or after September 1st, 2021. Again, we're asking for this data as preliminary data. You will be giving us or filling out a second survey. That second survey is what we'll utilize to make vaccination incentive payments, and that date will be January 14th, 2022. But here, we're asking for the total number of employees, discrete employees, again, not FTEs, persons here. The number reported in question E, how many are full-time employees, how many are part-time employees, 20 hours or more per week, less than 20 hours per week. And then, yes, and then again, E has to equal F plus G plus H, so make sure that happens. And then in I, we are truly asking for FTEs here. And here's really just a check of the total number of FTEs associated with the number reported in question A. Just so that we have an idea, you've given us number of discrete individuals, but what does that mean with reference to FTEs? And then we're asking for the certified capacity of each of the programs, really just to get an idea as to whether certified capacities have changed measurably from, from information that we currently have. And then Again, all information must be compiled based on agency payroll data for the first payroll period ending on or after September 1st, 2021. And then this question, do you provide more than one OPWDD program, will prompt you to complete another survey if you have more than one program, and then after you've identified information for 5, then you would, if you have program 6, you go back to the very beginning and complete another survey, or 6 through whatever. This may be a little bit difficult to read, the slide here, but this is a sample of an Excel survey spreadsheet. As I said, we will give you a link, and so that you hopefully can download this and utilize this format or a format that works for you that we think will aid in you filling out the survey. Okay, so next steps here. Following the completion of the surveys, OPWDD will analyze the responses to determine the applicable payments to each provider agency related to the COVID service payment. And we're being specific here to COVID service payment because it's identified before information on or after September 1st, 2021 is directly related to our calculation for the COVID service payment. It gives us preliminary information for the vaccination incentive payment, but a second survey will be completed by providers to give us information necessary for the calculation of the vaccination incentive payment. And as I identified, that survey will report updated vaccination status as of January 14, 2022. The completed attestations must be submitted to OPWDD no later than January 9, 2022, and you have this. I'll just identify it's opwdd.sm.covid.attestation@opwdd.ny.gov. And all questions related to the completion of the surveys must be submitted to covidsurvey@opwdd.ny.gov. Not to go to Kevin, it's not to go to Joanne, it's to go to covidsurvey@opwdd.ny.gov. And questions regarding the attestation should be going to opwdd.sm.covid.attestation@opwdd.ny.gov, not to a particular OPWDD staff person. Okay. All right. Just a couple of questions. I think that while Kevin was speaking and while I was speaking, I think we addressed most of the questions that were asked by providers that would be germane to all. There were some providers that asked very agency-specific questions. Again, before submitting agency-specific questions, please identify, the fact that we've given you the guidance. So in most cases, we expect you to read the attestation and develop a distribution plan based on that attestation, or the guidelines in that attestation. We're not going to be identifying components that should or should not be involved, in your distribution plan, except for those that we've identified. And of course, you are at the core of this. You are thinking as to what is best for those very, very valuable direct support professionals that are part of your agency. Some people are concerned about the fact that during the base period of the consolidated fiscal report, they were, or subsequent to what we're utilizing, their agency merged. Please be aware that we do have a list of merged organizations, and when the funding is, levels are developed, they will take into consideration mergers.
Now, Joanne, just on that point, and I just want to articulate this, sorry, it's Kevin again. That's where we're aware of like a holistic merger of agency A and B. We are aware that one or two residences may have changed auspice from provider A to provider B, but that both, you know, the legacy provider still is delivering ResHab. We cannot take that into consideration in calculating these payment levels. That's something that the provider agencies are going to have to discuss and deal with, right? What Joanne referenced were those where we've had a holistic legacy provider doesn't exist, the new provider does, and we've reflected that in the payment level. Okay? Sorry, Joanne.
No, that's fine. We have some questions about how these monies should be reported on the CFR. We'll get back to you with more consolidated fiscal report guidance shortly. We had some people ask what programs are covered. We've tried to cover, you know, OPWDD programs either through Appendix K or through the state plan that, as Kevin identified, is yet to be approved by CMS, the federal government, but hopefully all of our OPWDD programs will be covered. People ask for, you know, whether temporary staff are covered by this. Well, we're kind of thinking of temporary as synonymous with contracted staff. You should have reported contracted staff. For retention and longevity, contracted staff will be reported in the CFR. We utilize that information. And when we report on the COVID-19 service and vaccination incentive survey, if those people are going to be reported on your CFR, you include them in the information that you give to us in the survey. Are only OPWDD staff eligible? And they mean staff covered by OPWDD programs? Yes. Okay. Yes. 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 And I think that pretty much covers what questions that we have received so far that were not otherwise specifically identified in this webinar.
Joanne, I want to add one more clarifying point, because I understand it's continuing to kind of elevate itself throughout the course of this presentation, which has to deal with the fact that we're focusing on the 200 series staff only. So I'm just going to be clear about that. This is only for staff in the Title Code 200 series, direct care. Many of you are raising concerns about the 100s and the 300s who have typically benefited from at least one round of state targeted compensation increases. However, as part of feedback from the stakeholder community that we engaged in since the onset of at least May, April, when we started our 507 planning process, the focus and the majority of the concerns we've heard have been involving direct care staff shortages. This money is intended only to shore up the direct care workforce. Thank you.